Hi everyone! Thank you for tuning into this bonus video on sleep hygiene. This video is an addition to our chronic pain management series. The purpose of the session is to educate you on what sleep hygiene is, the importance of good quality sleep, and strategies you can use to optimize your sleep. We will start this session by explaining why sleep is important to daily function. Then we'll talk about the consequences of poor sleep. Next, we'll explain what sleep hygiene is, and finally, we'll provide some helpful strategies you can try to use to assist you in getting a good night's sleep. Sleep is important because it is the primary way our bodies recover from the previous day. It's a way to give your mind and body a reset, which can help improve your energy levels, stabilize your mood and cognitive abilities, and repair both your muscles and your heart from strained use. Without good sleep, there are physical and mental consequences. Poor sleep can take many forms, but here we're going to talk about two conditions that can cause disruptive sleep and hinder sleep quality that may be common in people experiencing chronic pain. The first is insomnia. Insomnia is the delay in ability to fall asleep or having a hard time getting back to sleep after waking up during the night, and it must occur more than 3 times per week to be considered insomnia. Individuals experiencing chronic pain, especially lower back pain, are at a greater risk of experiencing insomnia. The other condition that can cause poor sleep is sleep-disordered breathing, which is also known as sleep apnea. Sleep apnea is associated with repeated breathing pauses while asleep, which causes reduced oxygen flow to the brain and other vital organs. Sleep apnea can worsen chronic pain symptoms. Without good sleep, your mind and body will not be able to function at an optimal level, and over time, continual sleep disturbances can lead to significant consequences, not only to pain symptoms, but also your overall health. Poor sleep can lead to difficulty thinking, a long-lasting change in your mood, and prolonged difficulty to cope with pain. As mentioned previously, if you have sleep apnea and it is unmanaged, less oxygen is getting to your brain, heart, and other vital organs. This lack of oxygen can harm your body. Poor sleep has also been associated with an increased risk of cardiovascular and metabolic diseases, which can lead to long-term health difficulties. People living with HIV are more likely to experience sleep disturbances than the general population. Poor sleep can lead to difficulty adhering to medications, as well as decreased immune function. Overall, research has found that sleep disorders remain largely underdiagnosed and undertreated in persons living with HIV. Therefore, it is important to talk to your physician if you feel you are experiencing poor sleep to get the proper care that you need. Sleep hygiene is a great place to start to improve sleep quality at night. Sleep hygiene is a set of practices that prepare your body and your environment for a good night's sleep. Sleep hygiene can include adapting the activities you do before bed, such as creating a bedtime routine, adjusting your sleep schedule, such as when you go to bed and wake up in the morning, and setting up your room to be more relaxing, such as getting dark curtains or comfortable pillows. One aspect of developing good sleep hygiene is creating a good sleep routine. This can take the form of creating for yourself a relaxing bedtime routine and sticking to a sleep schedule. To create a relaxing bedtime routine, identify simple activities that help you relax, as well as activities that prepare you for bed. This might look like drinking caffeine-free tea while you read, then brushing your teeth and washing your face, then doing 5 minutes of mindfulness before getting into bed. Whatever it is, do the same activities in the same order to prepare your body for bedtime. The key is to make this become a habit so that your body will begin to pick up the pattern and recognize that it's time to go to bed. Over time, this will naturally make you feel tired. To stick to a sleep schedule, try to go to bed and wake up around the same time every day to help your body create a natural sleep and awake cycle. This cycle is known as your circadian rhythm. Your circadian rhythm helps you stay awake during the day and stay sleeping at night. Any disruption in the rhythm can negatively impact your ability to stay awake or stay asleep. The key to sticking to a sleep schedule is to also do this on the weekends. If this is not something you think you could do right away, create goals for yourself to gradually get there. Check out our video on goal setting to help you create practical goals. Here are some helpful, concrete strategies you can use for good sleep hygiene. During the day, do try to be as active as you can, get as much sunlight as you can, and do your best to get some exercise, whether that be an early morning run or a gentle walk during your lunch break. While at home, avoid using your bedroom for doing work or even relaxing. You want your mind and body to associate your bedroom with sleeping. Right before bed, refrain from eating big meals or using harsh blue lighting like your cell phone or television. Doing this can help you feel more tired as you go about your nighttime routine. Make sure your head and lower back are properly supported while you sleep. We'll go over more of this on the next slide. If you are having difficulty falling back asleep in the middle of the night, try going into another room and practicing yoga or mindfulness. Check out our yoga and mindfulness video session to get yourself started. Whatever strategies you try, keep a sleep diary to track what was helpful or unhelpful that night. This way, over time, you'll be able to identify patterns to help you create the best routine for yourself. This slide has been taken from the activity scheduling video session. We will also be talking about how sleep positions may change if you have sleep-disordered breathing. Starting with the green box, the best sleeping position is sleeping on your back while having a pillow under your head and under your knees. This position spreads your weight out evenly over your whole back, while the pillow under the knees minimizes stress on your lower back and assists in maintaining the natural curve of your spine. This can prevent muscles in your back from remaining tense while you sleep throughout the night. For individuals with sleep-disordered breathing, a mild degree of head elevation can be helpful. This can be achieved through an extra pillow under your head and shoulders or purchasing a wedge pillow. Next, the orange box pictures a decent position for sleeping. When sleeping on your side, you want to place a pillow under your head and another pillow between your knees and thighs while bending the knees slightly. This position is not as optimal as being on your back, but placing the pillow between your knees can help keep your hips in alignment, which also helps keep your back in a better alignment. If you do sleep on your side, it is best to switch which side you sleep each night in order to even out your body. For individuals with sleep-disordered breathing, this can also be a helpful position. Use pillows for support in the same way it is outlined on the slide. And finally, the red box. Sleeping on your stomach is the worst position to sleep in. Laying on your stomach flattens your spine, preventing it from remaining in its natural curved position. Being on your stomach also places extra strain on your back and neck muscles, which can lead to greater discomfort the following day. It can be hard to change the position you sleep in because most of us have slept in the same position for years and find it to be the most comfortable. This most likely will be a hard habit to break. If you are a stomach sleeper, maybe just try starting on your back or on your side for 10 minutes when you get into bed a few times per week. Once this feels more normal, then you can lay in these more optimal positions for longer periods of time to attempt to decrease discomfort the following day. Again, check out our goal setting video session to help break down long-term goals into smaller, realistic goals. Here are some final take-home messages for creating positive sleep routines and improving sleep quality at night. During the day, take some time to exercise and make sure you're getting adequate sunlight. Before bed, create for yourself a relaxing bedtime routine and limit the time you're using bright lights or on your phone or TV right before bed. If you wake up during the night and are having a hard time falling back asleep, go into another room and practice relaxation techniques like yoga and mindfulness, or even get out a book and read until you feel tired again. When you wake up in the morning, jot down things that you did in a sleep diary to keep track of helpful and unhelpful sleep routine patterns. That's all we have for our sleep hygiene content. Thank you for tuning in to our additional video, and please look out for more videos to learn about other strategies you can add to your pain management toolbox.